Mary
Eric.
Craig.
Okay, that's two.
Eric Weston.
Great, three. Anybody else?
Charlie is not at the meeting. I had talked to him Friday. He said he would be here. He has not arrived yet. I have not
Okay.
heard differently.
Well, hopefully he's well. So why don't we move along then? And certainly we have a quorum. So the first item here is a public comment. So this is the opportunity for anyone from the public to come forward, make comments, and certainly anything on the agenda. So now's your time.
Okay, at this time, there's nobody within town hall that wishes to speak. There are people in attendance are on the agenda. I do have one email that was submitted today regarding the mask, and it's very brief if you want me to read that, Mr. Chairman.
Yeah, I haven't seen anyone else. Board seen a letter or any kind?
Nope.
I sent you a copy right at the last minute, Mr. Chairman. I don't know if it came through to you, but I can read it now briefly.
Oh, great, sure.
Okay. This is from a Chris Lane. From talking to him, I do not believe he lives in town, but had a question about wearing masks. And the letter states to Mr. Murphy and the board from Chris Lane, he is very concerned that masks are still being recommended for several reasons. First and foremost, they don't work. Many studies over the last few years in multiple countries have shown conclusively that they don't work, except for the N95 mask, which is not what the general population is wearing. The pore size in most masks are too large to stop viruses from entering or leaving the mask. The second point of three is that he believes that most people wearing masks feel safe, even though they are not. It is giving them a false sense of security and actually potentially causing more harm than good for that reason. They may get close to others than they would if they weren't wearing a mask. Third and last point is that wearing masks increases carbon dioxide levels in the blood. That is unhealthy and dangerous. This can cause confusion and dizziness, leading to falls. Very dangerous for everyone, but especially for older people who may have equilibrium issues in the best of circumstances. We don't want to see increases in broken hips or head trauma. I would appreciate if you would take my points into consideration and discontinue advising indoor mask. Best regards, Chris Lane.
Bruce, just repeat the last sentence.
I would appreciate it if you would take my points into consideration and discontinue advising indoor or any mask use.
Okay.
That was all the information that was submitted.
All right. Certainly, any member of the board with any comments? If not, we can keep going.
Oh,
Is there any truth to the increased carbon dioxide level in blood?
I haven't read anything about that. I would hope if that were true that we would know about it.
By now, yes.
Yeah. I mean, they're used throughout the hospitals. They're used in the intensive care units. This is going on 3 years. But certainly the gentleman, I mean, would certainly welcome any references to any science studies, any of the major medical journals. You could certainly send that to us. Send some links and we certainly would take a look at them, but I'm not aware of any.
There have been certainly studies done of the effectiveness of the masks. And right now, the latest I read was like 33% for the cloth masks, 56% for the surgical masks, and 70+% for the KN95 or N95 masks. So they are effective. There are lots of things that impact their effectiveness, whether they're soiled or wet or clean, and whether they're worn properly, whether it's a proper fit. But masks are effective.
And Mary, what is that percentage referring to exactly?
The effectiveness in filtering out the virus, or the droplets, I should say, the droplets rather, when you're speaking or laughing or talking.
So in other words, that comment on the letter in reference to the size of the particles, I mean, what you're saying is.
Well, yeah, I think he was referring to the cloth masks specifically, which are the least effective. And then the surgical mask, maybe he's talking about also, because there are a lot of people that are wearing them or have been wearing them instead of the cloth masks. But they certainly still do filter some. And that's why we've continued to say social distancing, not just mask use, but social distancing also.
Thank you.
Well, good questions there. Thanks. Anyone else? Bruce, did anyone else call in or present, coming in late?
If anybody is in the waiting room that has a question, they can put their hand up if they wish to speak at this time. I believe nobody's putting a hand up at this time. I think they want to speak at a later date, Mr. Chairman.
Well, this should be the opportunity to start now, I think.
I think one of them might want to talk at if they're talking with the tobacco later, not tobacco, excuse me, the later when we talk about the COVID questions, and if there's going to be any questions on a draft proof of vaccination. I don't see something from the chamber at this time.
Well, that's fine. That's great. You always welcome comments. So good. We'll give them an opportunity later.
Okay.
Okay, so the second item here is a hearing. It's a retail tobacco violation. Location is 50 Long Pond Drive convenience store, and that's in South Yarmouth. This will require a vote of the Board of Health, and the specifics are a sale of flavored tobacco. So, Director Murphy, just give us any appropriate details.
Yes, we have the owner of the store. You can sit right at the front table, Stephanie DeVito. This was on the agenda, Board of Health agenda, a couple weeks ago, but was unable to attend. What we have is a retail violation for selling flavored cigars. Flavored cigars is a state violation and also a town violation. So you have that letter before you, and then you also have the second item that was within the packet was the inspection report from the county health department tobacco control program, who did the compliance and noticed the violation.
When was that, Bruce?
This is her first offense. She's a new owner of the retail establishment. Myself and Phil did meet with her before she did go in to review the tobacco regulations with her. But I think you'll understand that she has a few points of concern she'd like to discuss with you. So with that, I'll let her discuss that with you right now.
Bruce, that was pretty recent.
December 15th.
Great, thank you.
Yes.
I bought the store in November, and it was leftover inventory, which is no excuse. I understand that I should know everything that's on the shelves, but I hadn't even really had a chance to go through like all the candy soda, like basic inventory. And when the gentleman came in and found them on the shelf, I immediately removed them and wanted to check it out and find out why they were flavored, because it wasn't obvious on the box. We had to Google it, and in the meantime, the inspector said that it was flavored. I pulled it. I have a repetitive inventory now that I continuously order week to week. I check the inventory myself, and am aware now that the inventory I have is within the law, and anything new I will double check going forward. I can guarantee that that won't happen again.
Questions, board members?
Sorry.
I had one. So I wasn't at last week's meeting, but I did watch it. And my question was, the other retailers, was it the same violation that was found, the same product that was found in all these instances, Bruce? The two from last week and this this one tonight?
It was a cigar violation, but I cannot recall what the flavor or the
Right.
of the
I think
cigar
it was the same. And the only reason I bring it up is because it sounds to me like from listening to the gentleman last, whatever it was, 2 weeks ago, was that it was whatever his distributor is, added product that he didn't order. And it sounds like everyone pretty much was in the same boat. And so I just wanted to, it looked to me like it was all the same product that was sent to these stores that they didn't even order. And I'm sure this woman here the night said that she bought the product and it was already in the building. So I just wanted to see if they were all the same, which I believe they were from reading what the violations were.
Can you say what steps you go through when you order your tobacco products to ensure that it's a statewide violation? So the distributor should know that they shouldn't be selling anything.
Well, he knew immediately as soon as I asked him. I called him and I asked him, he said, that's flavored. I'm like, well, it's in my store. But they're tri-state, so they do Rhode Island, New Hampshire, and Massachusetts. And I don't know if one slips in, but it won't slip into mine because I ordered the same thing. Basically, my inventory is based on what customer wants, regardless of menthol cigarettes or flavored this and that. And going forward, if they want a new product like Fronto Leaf or something else like that, I can Google it. I can research it before I okay it to come in the store. And the inventory I have right now, like I said, the customers come back for it, so I reorder it, so I know it's safe or legal. That was like a mishap. It was on the shelf. It was a half a box. Who knows how long it was, I mean, I had it a month and it's not something I ordered or was replaced by the distributor. And he knows I'm here now. So, I want to keep him on his toes. I don't want substitutes. I don't want trouble.
And when did you take over the store? When did you open it?
November, and this happened December.
Okay. Mr. Chairman?
Yep. Any other questions or comments? This is will require a vote, just so everyone knows that again. It's basically, we'll talk about a sale of flavored tobacco, which is not legal, as Bruce said, town and the state, and apparently it's a first offense here. So,
I'll make a motion.
sure.
Okay. I move that we forgive this initial retail tobacco violation at the Long Pond Drive convenience store, given that the owner had just taken possession of the store. It sounds as if she's very serious about complying with the regulations and the law, and that she realizes that distributors will often slip in things that were not meant to be ordered. But this is
Emphatically second. Oh, sorry. Go ahead, Mary.
this is just the only time this will happen.
Excuse me, Mary.
Yes.
That was a long motion that we were trying to write down.
Okay.
If you want to just boil it down to like one sentence, are you stating that there would be a one-time warning?
Yes. Correct.
Maybe you could just reword that quickly.
Yes. I move that instead of a fine, this be a one-time warning because the owner just took possession of the store a month before the inspection happened.
Great, Mary, thank you. Is there a second to the motion?
Second.
Hey, okay, so any discussion here? I have a couple comments. One, yeah, it sounds like tough timing there. I mean, we're trying to encourage people coming into town and running businesses. It makes it very difficult, certainly when we do warnings and then not maintain the fines. So it does get difficult. So, but I understand it as well, having the owners there for a couple of weeks. That's a tough start. So why don't we take a vote? Anyone else any comments or not? Okay. All in favor, just raise your hand and say aye if you're in favor of the motion made. That's
Aye.
Aye.
You
Eric?
probably need to do it by roll call, Mr. Chairman.
Oh, okay. From left to right here, I can see Eric.
Aye.
That's it. What is that?
Aye.
didn't hear you. Aye. Okay. Deborah?
Aye.
Mary?
Aye.
Myself, aye. So it passes unanimously. Okay. Thank you for coming in there, and let's move on here. We got
Thank
looks like 3 hearings, all on the same subject. So take a look at number 3. Is there anything going on the screen for this or not, Bruce?
Yes, we can put the agenda up just for the public to see.
Great, thank you.
But the next 3 hearings for violation of the Town Board of Health handling and storage of hazardous materials for a late filing of their licenses that are due on July 1st. So we have a letter right now, I think what we have on the screen posted, but that's fine for us. Do you want it up on the, I think as long as the agenda's up there, Erica, that's all, the letter.
Yeah,
And the letter and the support documents are in your packet. And with some general background, Carl Lawson, the hazardous waste material inspector, is here and can give you some background.
right. So just board members, if there's some comments you need to make, just please keep in mind that the public at home cannot see all the details that we saw in our packets. That's all. Okay, Carl, thank you.
Hello, Carl Lawson, Hazardous Materials Inspector for the Health Department. So we have a hazardous materials licensing program for businesses that use a store above a certain threshold. And that's for handling and storage to ensure groundwater and environmental protection. And with the licensing program, we send out notices regarding renewals. We send out renewal applications. This year, the first notices were mailed in May. And the license applications were due June 30. Then we mailed second notices in September. Third notices were mailed in December. And along with the third notices, I made a phone call to each business. At that point, we had 3 outstanding and made them aware of the third notices being mailed and that they were overdue. And I left, in some cases, a voicemail. In some cases, I spoke with the business owner. In another case, I left a message with office staff. And when there was no response, then we did a 4th notice a week ago. And that notice required attendance at a Board of Health meeting tonight to come into compliance and map out a road for the future so that this doesn't happen again. And just make sure everything is understood in terms of registration. So that's where we are at this point.
How many businesses do you have that you had to send out and there was?
About 180 businesses. It varies a little bit each year, but about 180.
Okay.
Well, it's a lot of work. We don't see too many of these, so I'm just going to read what our purpose is as the Board of Health. I'm just reading it right out of regs here. Okay. The purpose of this Board of Health regulation is to safeguard the public health safety, and welfare by protecting the ground surface waters of the town of Yarmouth from direct or potential contamination by toxic or hazardous materials, which contamination therefrom could result from the improper storage, handling, or use of such materials. It's a lengthy reg, but I think that's just a summary of what I guess the purpose of us and what we need to address tonight. We certainly, I guess, do we have someone here tonight?
Yes, there's somebody for each of the violations are here to explain that. And the first one, if you want us to bring up, is Lee from the owner of Brentwood Motor Lodge. Ken?
Sure. So, Bruce, so I mean, there's several ways this can go, or I guess options of how to proceed. One is to revoke, one is suspend, and one is to modify, as I recall, a license. And then there's the issue of a fine that needs to be acted upon, make a decision about. Is that correct?
Correct. The board can also take no action at all. They can just listen to what the status of these businesses going forward and what their new plan is to stay in compliance. If the board doesn't feel comfortable with that, additional action could be taken. Right now, we've not issued a fine in the past for any businesses that have been late. That option is available if the board wishes to. There's no criteria set for the amount of fine, but the board could follow the fine that the tobacco violations are issued for a first offense of $300. So I think the board has a little latitude based on the responses from these three business people.
Okay, thank you. So why don't we start with someone from Brentwood Motor Inn, which is located at 961 Route 28 in South Yarmouth.
Yes, the person is available right here. If you just like to, Kyle, you want to just introduce him and ask him what the status is?
Yes, this is Mr. Lee Hune, and he is the owner and manager of the Brentwood Motor Inn, 961 Route 28 in Yarmouth.
Okay. And you want to just explain why maybe you didn't get your license in on time, or what's your steps you're going to go forward with?
Yes. During the last 2 years, we have a very hardship because of the pandemic. And every single time we want to do something, or the business running is very hard. That's mean not very hard, not mean I don't want to follow the rule of the town, but they're very hard because we don't have enough the people, and always something that keep happen, and we keep forget. And but that's my mistake. I'm not follow up all the license. That's I make a big mistake. And the last time I spoke with Carl from health department on December, then I talked to him. That's I make a mistake to misunderstood the miscommunication, because Carl said on May, that's mean the new make the new renew day. Then I thought myself, I said, oh, that's May. That the May I start the season, I go to all the license anyway. Then that time I submit all, but that's the miscommunicate right there. I mean, bring me here today and make the town is not happy about me.
Okay. Kyle, has he submitted applications for this year?
Yes, he did today, submitted his complete materials.
Okay.
Did this gentleman own the business then a year ago? Same person?
Yes.
Did he come before the board last year or not? I don't recall.
No, this is the first offense that him or any of the other businesses are before the board.
Okay.
So I have a question. Does that mean that for all of these businesses, they cannot operate because they don't have a license, and their license is it not possible to be renewed until later this year, say May, June for one of them? Is that what's happening here?
The licensing period under discussion tonight is these licenses run on a fiscal year, as Bruce mentioned. They run from July 1st to June 30. So right now we're in the 2021 to 2022 fiscal year. So the licenses under review tonight were due last July 1st. And they're late, and they're being addressed now.
Okay. Thank you, Carl.
It's not future licenses.
So-
Right.
So, I'm sorry. So Carl, you're saying these are 8 months late, basically?
Yes, approximately 7 months.
Okay.
So they've been operating without a license so far this fiscal year. And are they able to renew their licenses for this fiscal year?
Yeah,
Because
they're able
one
to.
of, because one of the folks said that he tried to and was told that he couldn't renew the license until June.
I think that was a license that was trying to be applied for in advance for 2022 to 2023.
Okay.
21 to 2022 license, which is the period we're in now. That can be renewed anytime from, last spring until now.
Okay, thank you.
You're welcome.
The other point of interest is the motel's been closed since when, October?
The hotel closed for the season on the end of September.
Okay. And when do you plan to open again?
On mid-May.
Okay.
What types of materials are stored on site at this particular business that require the license?
This business stores dry and liquid pool chemicals, institutional cleaners, and paints.
Carl, during your last inspections of the properties or the inspections over the last couple of years, have they been in compliance?
Yes, the business has been in good order regarding material use and storage.
Well, board members, how would you like to proceed?
I move we let the gentleman renew and pay for his, what is it, 2021 to 22 license?
Second,
Any discussion about renewing a license for this year, 21, 22? Anyone? This is just one topic on it or one subject on it. Okay, all in favor of the motion then, just say aye.
aye.
You got to do roll call, right? Okay, so Eric.
I,
Deborah.
Aye.
Okay, Mary.
Aye.
And I do as well. So that passes. And the issue then is a fine. That's a different subject here, whether or not to invoke a fine.
I move to invoke a fine,
To what?
not even invoke a fine. No fine.
Okay,
Second.
any discussion?
Is there a second to that?
I
Okay,
said,
Mary? I think so.
Okay.
I would strongly suggest adding June 30th to whatever calendar is being utilized, whether it's a phone or a computer calendar. Ideally prior to June 30th, but if the date doesn't change, definitely a good day to set a reminder for.
Yeah, I mean, someone's running the business. I mean, it's pretty straightforward. I don't think the date has changed in years, if I'm not mistaken. Carl, has the date been changing or not?
No, the date has been June 30 throughout the entirety of the program, which
Right.
goes for about 30 years. Yeah.
Yeah.
It's been consistent.
Okay, so Why don't we vote on the motion then? And all in favor of the motion? Just we're gonna start from the left and go to the right. Eric,
Aye.
Deborah,
Aye.
Mary.
Aye.
Okay, and I'll vote aye as well. So there will not be a fine for this gentleman. I'm sure the board may feel differently if it happens again next year. So why don't we move on?
Okay.
Absolutely.
Okay.
Thank you
very much for both.
Thank you for coming in.
Thank you.
Okay, fourth item here is a hearing. It's Rescon Restoration and Construction. They're located at 110 Old Townhouse in South Yarmouth. And once again, we have to make the same decisions and what to do about the license and whether or not to invoke a fine or not. Same issue of failure to redo a license. So hopefully somebody's here. Or
Yes,
be
this
the time to-
person is in by Zoom, and we'll let that person into the meeting now.
Great. After that, Carl, I if there's anything different about this case, we can just comment on it for us. Okay. I'm sorry about that.
No, this case is similar, and Mr. Chris McDonald, Operations Manager with Rescon Construction and Restoration, is joining us remotely.
Great.
You want to give the background for that one?
Yes, as with Brentwood, 3 notices were sent. In the case of Rescon, they go to their central office, as I was directed to send by their compliance manager last spring. So they got a first, second, and third written notice. Also, along with the third notice, I left a voicemail for their compliance officer. And then the fourth notice was sent last week. And at that point, Mr. McDonald became involved and is joining us tonight remotely to discuss the situation with the company he represents. And that's where we are at this point.
How long has the business been there, Kyle?
The business has been there since 2014, was a new business at that time.
Okay. Have you inspected the business?
Yes,
And in the past, how has it been?
they've been in compliance.
Okay. And
Licenses have been on time in the past.
They've been late 4 times over the last 9 years, and it's trended worse recently. They went through a merger, I understand, and at that point, things became less on time in terms of submittals.
Yeah, maybe at another point, we got to talk about this. I mean, you're following 180 businesses. People just need to apply on time. Your time is valuable, and the idea of having to send 3 reminders, it's crucial. If these people want to run their business, they need a license. So at a later date, let's talk about it if there's a different way to communicate with people or whatever. So anyway, someone from Rescon?
Yes, Chris McDonald here. I just wanted to first apologize. Just to speak to your point, I would 100% agree. It's a waste of someone's time to have to hunt us down when we should have been in compliance in the first place. So I do apologize for that. As Carl had mentioned, we were recently acquired. Our previous name was ARS. ARS was acquired by Rescon Restoration, and the safety compliance officer was in charge of the 7 branches we have here in New England, as well as Georgia, Texas, and Florida. And unfortunately, I think that she wasn't with us for very long, and those emails did not, they weren't forwarded to where they were supposed to go. And so, again, I do apologize for that. When Carl reached out to me, I was as prompt as possible to address the issue. We've sent in the application. I'm aware that the $150 fee needs to be paid, which we have asked. I've asked my corporate office in Newton to send a check for that. We have removed the cleaning equipment, chemicals from our Cape office. Just to give a quick background, I run the office in Sutton, and the office in Sutton responds to any water losses that we have on the Cape. The Cape office physical address, 110 Old Town Road, does not house any chemicals currently. I did speak to Carl about setting up an inspection, maybe later this week, just to verify that. I do understand that this meeting is in regards to the 2021-2022, which we're responsible for. And I want to make good on that, obviously. But we will not be seeking the license for the 2022 time period, as the chemicals are no longer stored on site.
Okay, thank you. Okay. Board members. When I'm looking at the screen right now, I see myself twice, Bruce. I don't see Deborah, if that is of some significance. Bruce? There we, well, there's Mary, but
Got Mary,
Deborah, are
but-
you able to put video on if you wanted to? If not, that's okay. Just tell us you prefer not to, which is fine.
Okay, just 1 second. We can let Deborah back in.
That's up to her if she wants to show video or not. Okay, I'm reduced to one picture, so something got corrected.
We go.
Okay.
Good.
Deborah, this is by choice, so just, that's all.
You're muted.
I'm so sorry. My Wi-Fi died. I had to sign in on my phone. Apologize.
No, not a problem. Okay. I was just making a point. For some reason, if you don't want to be on video, that's fine. That's all. We saw you.
No. I got kicked out. I'm back.
Hey, did a pretty good job then converting to the phone. Okay. Okay. It's the same subject here. So, board members.
I move that we accept the application for 2021-22 for Riscon Restoration and Construction, with the understanding that they will no longer be storing hazardous materials at the site, and without any penalty of fine.
It was
But it's a
concise.
dismal record, I will say that.
Yeah, that was concise. Thank you, Mary, as usual. Okay, is there a second to the motion?
Second,
Okay, thank you, Eric. Any further discussion? Let's see that there's none. So once you vote, anyone in favor of the motion? Here we go. Eric,
aye.
Mary,
Aye.
Deborah,
Aye.
as well as myself. Aye. So that passes and we can move along. Okay.
Thank you for the consideration.
Okay, very good. All right. It's another case, the same thing. Here's Silver Cloud Towing. They're located at 797 Route 28, South Yarmouth. And once again, it's a failure to renew license. And it's a Board of Health regulation, handling and storage of toxic and hazardous materials. So Carl, any specifics here that we need to be aware of?
Just the same timeframe as the previous businesses. First, second, and third notices will mail to them. And at the time I mailed the third notice, I made a phone call to the office, spoke with office staff, notifying them a third notice was coming, and the office staff told me they would relay it to the powers that be. And then a fourth notice was sent last week with notice of the Board of Health hearing tonight. So the same time frame as the other businesses.
Just same ownership for a while of this business? I'm not familiar with them.
Local business, yes.
And they've been in business or same owner for a while?
Yeah.
Okay, all right, fine. So someone here to represent or the owner?
Yes, the owner is and is with his attorney.
Yes, my name is James Quirk and I represent Edward Quirk, who's the owner of Silver Cloud Towing. And I can tell you that he was not aware of this bill until the other day, and he's paid it. He attempted to pay both years and has paid this year. He's like many other businesses, he's had problems with health because of COVID-19. He's had problems with his staff and keeping his staff just because the marketplace is the way it is with employment. His business has been involved in providing workplace housing to try to manage employees continued working for him. But he's lost a number of people over the years, and the kinds of paperwork and stuff that they have that goes through the office is amazing because of the kind of work he's doing with insurance companies and everything else. So it's not an excuse that we wouldn't pay it. He pays $16,000 a year in just excise tax alone to the town of Yarmouth. And he does pay his bills. He's got a substantial sized business and he's started it himself 30 years ago. So it's not a question of not wanting to pay. It's a question of managing paperwork, which we've made some arrangements to ensure that there won't be a delay or late payment going forward.
It seems to be a trend that this seems to happen frequently. So what's the history here? Is this, has this happened before or not? Carl?
Yes, it's happened before. So we follow the same procedure. We send the renewal notices with new applications, giving them some time to respond.
So this has happened in the past, not just this past year.
That's
Is
true.
that-
Because, I mean, the information that was provided in the packet that it's rather frequent. Apparently, if this is the case, it's 9 out of the last 10 applications were late. So that's disturbing.
Mm.
Once again, it's two things. One, Carl, you're following 180 plus businesses, and the other is operating without a license, essentially. So it's obviously of concern.
Carl, what are the hazardous materials that this business is storing?
Mainly just motor oil and antifreeze for the company's own vehicles. He's not in the business of commercial repair, just doing maintenance on his own company fleet.
Thanks.
Have they been, Kyle, just jump in, have they been in compliance with their storage over the years when you've done your inspections?
The inspections have been good.
All right.
Yes.
And if I could just jump in real quick, Mr. Chairman, do they have Jim, I know we were talking earlier about some type of system they could set up a reminder in June to license renewals?
Yeah, we have a computer system so we can do that with a calendar and that we make sure it's done.
Okay.
I mean, it seems to me like you guys really need this license to operate. You've got a lot of vehicles in your fleet and you need to be able to maintain them. It's essential to conducting your business.
Mhm. Correct.
Any other comments, either from Silver Cloud Towing or from the board members? Anything?
I just say that, as I say, he's been in business. He started himself with nothing and has been a lifetime resident of the town of Yarmouth and done well with his business. And we'll just have to ensure that, like I say, we've set up a system to make sure these things get paid. He's lost the people that have been doing the administrative work on several occasions over the years. And somehow this slides through the cracks. We would make sure it doesn't happen again. He attempted to pay for the next year as well when he brought the check in for this year.
Right.
Yeah, and I'll just address that point because you did mention it earlier, Mr. Chairman, that he did, the owner, Ted, did bring in a check for this year and the upcoming year, which is fine. It's a little difficult for us to process a check, 5 months early. So what we'd like to do is, because we'd have to hold it to June, is just give you the check back and you can just give us the 150 now and then come June, just pay us the regular time, which they're agreeable to.
Yeah,
On time.
yes.
Okay, Mary, hello.
I move that we accept the license application for 21-22 without fine, because we need to discuss this at a later meeting. But I think that, given the record of the company, I'm doing this very reluctantly.
Is there a second to that motion?
Second.
Okay, any other discussion? Yeah, this is difficult. I agree with you, Mary. If, it's great someone's able to maintain a business for 30 years, but it's hard to accept that 9 out of 10 times someone doesn't get a license, in on time, to apply for it. It's pretty straightforward. So yeah, I'm reluctant also, but I think our board has gone out of our way over the years to treat everyone as equally as we can. We made a tremendous effort, certainly with the tobacco stores as well. So why don't we vote unless someone has another comment?
My only other comment was that, I'm familiar with this business, and that obviously the people in town depend on this type of business when their cars break down. So it would really be a shame to see something happen to, where they wouldn't be able to operate, that's nobody, it would be a huge disservice to everybody. So.
Yeah, good point, Eric. I agree.
unfortunate.
Yeah, no, I agree. The last thing we want to do as a board is to revoke or suspend someone's license who's in business here in town. This is not what we want to be doing. So why don't we go ahead and vote? Eric?
Aye.
Mary?
Aye.
Deborah?
Aye.
I'll vote the same. It's aye, so that's unanimous. Okay, so just another comment. Once again, Bruce, we need to put this on the agenda for discussions. Okay, it's just your department. Time is of the essence here. You don't have enough employees right now. We know that. We have open positions. And I think we need to put it on the agenda. Why don't we do it for the next meeting, just to talk about it a little bit and decide, are the regulations, do they need an update? I think they go back years. We haven't been looking at it. So, okay.
The other thing, Hillard,
Yeah.
maybe Carl could just do a little bit of a poll of some of the other towns to see how they handle this, if they have fines, and what the current standard is in terms of enforcement.
Yeah, we seem to be a lot more assertive and proactive dealing with tobacco. We always feel badly in town here if we're going to be fining a tobacco store. So, okay, once again, we're trying to treat people equally. That's really what we try to do. All right, why don't we move along here? We're up to number 6, and this is a discussion and has to do with town wastewater treatment, something we haven't discussed in a while, which is great. Director Murphy, what are the specifics here? I know in our packet there was a draft of a letter.
Yes, we do have a letter presented to us from the Assistant Town Administrator, Bill Scott, who will be on tonight, who is give you the board an update that he is on currently right now.
Oh, great.
Hi, how is everybody? I can't see myself. I'm not used to this, but I'm used to running these meetings. So what I've given you is a resolution. I'm sorry.
See him?
Can you see him? All right. It doesn't matter. You can just see W. Scott and we'll go from there. What I've given you is a resolution to support a wastewater treatment system. Important and inherent in moving forward with these things, project of this magnitude. You want to get each jurisdiction to sort of make a statement as to the important aspects of the project as related to them, and then resolve that they support the project within the context of those. So what this is rather than a letter of support, which is sometimes stoic and, time sensitive and doesn't cover everything. This is an opportunity to basically say whereas, and you make certain statements as to the reasons why your jurisdiction, the Board of Health, feels that this is important. And then you wrap it up with a now therefore, the construction of wastewater managed by the town is crucial infrastructure important to reduce the impacts of on-site septic system and begin to reverse the environmental degradation leading to impacts on human health. So what I wanted to do is just hand this off and then work with possibly two members that would be willing to edit this to where you might want to be. This is not something that I'm asking anybody to adopt this evening. There are probably regulations that you might want to put in here, different statements of fact, whereases, and also a different statement of the now, therefore, and further. But the important thing is, by virtue of making these resolutions, we move forward in grant applications. I've used these before, public meetings, in other seeking, permits, that it's a much more sort of manageable and informative way to go through the process and have this on record. So clearly it's not something, I've received some of the information from the material I've read from the MAP and others and from other department heads, but it's entirely up to the Board of Health if A, they want to move ahead with this, and B, what else would you like, or what would you like differently in this document?
Thank you. Yeah, and letter was really well written. So board members, it's discussion time.
Is this something we can put on our agenda for like a future meeting so we can really go through it point by point?
Sure. If I may, Mr. Chairman, I was thinking, your next meeting like a month from now, and then I could work in the interim with members. I know Mary is a member of the RAC committee. Should be helpful in this regard because she probably can guide me to better points than the whereas I have. But another member, and then we can discuss it and then bring it to your future meeting, giving you enough time to read it in its newly formed document after other members help me edit it. So a month from now will probably work if that's good for the board. Am I still there?
I'd be willing to help out too if you need a second volunteer, Mary.
I was going to recommend you, Eric, just because it's not something I know that much about, but I know that's sort of in your wheelhouse.
I'm very excited about this, I have to say. It's long overdue.
I'm sure you are.
Awesome.
And Mary, you would stay with this?
Yes, I had already told Bruce that I'd be happy to work on the document.
I'll be the backup for both of you, okay?
Okay.
Just let me know if you're gonna, obviously we need updates and so on, and we can put it on for our next meeting to discuss Bruce, any thoughts here?
No, I think that's a good plan of action for the board. I think during that period of time, the board members can work with the assistant town administrator and myself to see if there's any other wording or references that we would like to include in the document.
Yeah, certainly don't hesitate to come forward. I mean, between this subject and the pandemic, that's really on the top of our list here as the Board of Health.
Well, thank you, everybody. And what I'll do is send an email to Bruce to send out to you as to sort of the next steps. Sometimes in these resolutions, you would refer to outside documents, dates, and things like that that support your approach. And those are some of the things I think we can do moving forward before your next meeting.
And I'm sure you're going to have our full support.
Thank you.
Okay. Bruce, do we need to do anything else on this
I think
subject?
that's fine. I'll work with the Bill Scott on that and bring that back to the board at the meeting in March.
Okay. Okay, seventh item is a discussion on the coronavirus. So there's a lot of items here listed for discussion. Bruce, just want to give us sort of an update on statistics and see where the town is. Then perhaps we can work our way down the list for discussion tonight. How's that, Bruce? Does that work for you?
Yes, it does.
Okay.
I want to make sure we have the slide presentation ready to go up on TV. There we are right now. So people at home and the board can see the program that we've used as the base for the last two meetings, along with the presentation to the selectmen. Again, this format was constructed and assisted with the Assistant Town Administrator, Bill Scott, working with myself to format it. So based on the update of tonight, February 7th, we'll proceed with the presentation. This first slide just makes note that the data within these slides keep changing and they stay updated. When somebody's looking at it, they need to look at the date, excuse me, on the front page of this, which stated February 7th. As of yesterday, Sunday, we had an active 66 cases within town. This is monitored on a daily basis by our staff person, Phil Renault, and provides these data to myself daily during the week. Thank you.
Bruce, just one comment. Bruce, sorry to interrupt. It looked like the deaths went up. Any details on that?
Details. 66 active positive cases.
No, I'm referring to the clerk death certificates. I thought we were in the 40s.
We were in about 45, 46. Then, excuse me. Then we had a couple come in, I think, before we forwarded them to the board. Then we had two come in over the last 10 days. So we are up to 50. We've only had three. We've had three deaths since January.
Okay.
Okay. We can see that how the cases have really increased from November to December, and then they've what we've seen now is that they've peaked in January as we start to come down now. Okay. We can see the peak from when we started on the far left, where the first wave peaked at 40 when the pandemic started in March. We kind of peaked in the April, May area, went through the summer. Then we had the second wave. It kind of peaked at 174 in December of 20. Came down. We saw the third wave peaking about March, April. And then we saw the fourth wave Delta variant start in August. Omicron variants came in November, December. And then we saw the fifth wave peak at 272 active daily cases that we had in town in January. Since then, we can see that how quickly drastically the decrease in cases have dropped from 272 to now, as of yesterday, only 66 active daily cases. So it's dropping, decreasing at a rapider rate than the increase. Okay. The positivity rate in town based on DPH from last week's results that came out Thursday. This is over a 2-week period. So this was still before it was dropping off as quickly. So you could see Yarmouth is still had a positivity rate of 16, which is lower than the week before that were, so that's coming down. As you can also see, 14 of the 15 Cape towns are now lower, with one town, Brewster, with no change. So I think you'll see the positivity rates continue to drastically decrease when the data comes out this Wednesday, Thursday. Okay, nope, that's fine. Hospitalization rates are also decreasing, as we can see. The last date we had this was last week, February 3rd, last Thursday. And we can see the number of cases are decreasing between both hospitals on the Cape. Thank you. Fully vaccinated, the question is, how we make it out on vaccinating our residents. We can see that the fully vaccinated residents we have, where we're located on the list of other towns, we have approximately 77% fully vaccinated, which is about 18,500 people. So I know our goal is to, continue to get more vaccinated and reach up to 80% as high as we can. So obviously there's some towns ahead of us and some towns that are still working on their vaccination rates. We are looking at having a future vaccinations upcoming. Okay. Boosters, we're looking at the number of people getting booster shots in town. Right now, we're at 44% of the town has had their booster shot. Puts us at about 10,500 people. So that's an area that we're still working on and encouraging also. Okay. COVID response for a lot more data is on the Massachusetts COVID information dashboard line. This is a hot link to that app web page, and this slide presentation will be on our town website, so people can go to it and get these direct hot links right to the state website for further information.
Bruce, just to go back on one or two slides, not to move the slides, but it's really on vaccination rates. We've been in the 70s for a while. Is that correct?
Yes, I think we've been in 77 2 weeks now. 2 weeks. We have moved up. I mean, we were at what, 74 about a month ago. So we have moved up, but very slowly.
So it sounds like it's plateaued. What I'm a little surprised is, what about children? I mean, it's certainly weeks or even a couple months now where children get vaccinated. That really hasn't changed the rate very much. Would you agree with that?
Yes.
I mean, we have more potential individuals. I'm sorry.
Right. No, we're also seeing more of the younger vaccination rates from, age 12 and up. They're starting to come in now. So it's moving up slowly. It just takes, with our size of population, it just takes a number of cases to increase a percentage point.
Well, I don't know. I can't work the math out in my head, but I mean, we must have hundreds or thousands of kids above 12 and under 18. That's all. Just surprised it hasn't bumped the percentage rate more.
Yeah.
I had a question about Provincetown. What's going on there?
About which ones? I'm sorry.
Provincetown, how they're at 129%.
Yeah, that's a good question. What we've noticed and from talking to the Provincetown is a lot of people when they took their vaccination stated that they were residents of Provincetown, but in fact, they weren't on the official town docket rolls. but it's not really cross-checked through the clerk's office. So if a person puts down, that's their address, that's what went in. So they have a lot of people that claimed that was their current residence. A lot of times in some of the graphs, when you see come out or statements come out in the newspaper, they'll just say 95% plus or greater than 95. And that would be true for Provincetown and Wellfleet.
I mean, it's astounding looking at the chart you put together of going from low, mid, upper Cape. I mean, the geography is perfect. I mean, what happens there? Numbers.
A lot of seasonal people.
I'm sorry?
A lot of seasonal people that have maybe have two homes that are here in the summer and not here in the winter. Maybe got vaccinated while they were here and put down their addresses as being here.
Okay.
I think the other interesting point is just because they're fully vaccinated did not mean that they would necessarily have a lower positivity rate. If we can go back to the positivity, right here. Yeah. The positivity rate is lower. I'm just looking at Provincetown is down to 8, which is good. But you look at who else was up there. Orleans, they're at 12%. So the ones that were way down the bottom that had the high vaccination rate, Provincetown, Truro, Wellfleet, have decreased quite a bit in Eastham. But then you still have Orleans that had a pretty good vaccination rate, along with Dennis and Howard. They're still up there on positivity rates.
That could also reflect, though, Omicron, the fact that it is infecting people who are vaccinated.
Correct. Okay, we'll move forward. Access vaccination records. Anybody at home that's looking for their record, Massachusetts has set up a webpage, MyVax Records. Mass.gov. They can go on to this for a live link if they're looking to, if they can't find their vaccination card or looking for a setup that they can put on their phone. This would be a site to go to. I know some people have having difficulty get on the site or checking their records, but it seems to be working a little bit better since when I've talked to a couple people. Okay. Vaccinations, County Health Department continues to do Wednesday's vaccinations at the county complex on Route 6A in Barnstable Village. Every Wednesday, pretty much 2 to 4. Walk-ins are welcome. They have all the types of vaccinations and boosters available. You can register online through the hot link and going through Barnstable County Health Department.org. Cape Cod Healthcare, Cape Cod Hospital at the hospital in Hyannis. Vaccinations again, Monday through Saturday, 8 a.m. to 6 p.m. And you can call that phone number on the screen for an appointment. And from talking to people, they've been able to get an appointment within 2 days. Okay. Vaccination clinics are still going on at Community College. That monthly program was extended by the state from January into February. And again, that's going to be 3 days a week on Tuesday, Thursday, Saturdays at the community college, age 5 and above. All vaccines would be available for a second shots along with the booster. And that registrations can be through this hot link right here and also going through Barnstable County Health Department.
Bruce, have they started with in town any second boosters or fourth injection for people who are immunocompromised? Is that started here in town or not?
I believe the county health department has. If people have a They were asking for a letter or something from their doctor, some type of format before they would provide that. I believe they're being provided, but I would have a person call each site to determine the status of them issuing or receiving a second booster fourth shot.
Okay, thanks. I mean, especially to the age of the population in town, that could be relevant. The number of people who may be immunocompromised here in town.
Yes. The local businesses, the pharmacy stores, Stop and Shop on Long Pond Drive, are also offering the vaccinations, and their availability for has been very well also. They do ask you to register on their websites. Cape Cod Melody Tent, as we move into testing, they're going to continue testing. Again, 3 days a week. Walk-in, it's all by walk-in or drive-in. And they can reach that through the Barnstable County Health Department website, or this live link website is also available. Testing through urgent care centers associated with the Cape Cod hospitals by appointment. CapeCodHealthcare.org. For the hospitals, you'll be able to make an appointment. And I know they've been readily available for testing also. United States Postal Service, they had this come out the beginning of December, where they would send out free test kits, and you can get on their website to order the test kits, the registration online, or you can call. We added a phone number that would be available.
The USGS did send out notice that they're on the way. I don't think they necessarily gave a date, but there was an update, so things are happening.
Yes, and I did talk to somebody today that received their test kits.
I got mine. It took, I don't know, maybe 3 weeks, two to 3 weeks.
Oh,
Good.
well, they should be in the mail. The people that ordered them in January to mid-January, they should be starting to see them now. It's still not too late to order the test kits or call for them.
Check your mailbox.
Check your mailbox. Okay, testing. The town is providing COVID take-home test kits. This is a town program. Phase 1 was distributed 500 test kits in December 20 and 22nd through Mary Wagon of the Town Community Development. Was provided and distributed to 223 households. That was phase 1. We are now moving into phase 2 in February of the take-home test kits. Again, Mary Wagon is overseeing that program, and test kits available through money that the town was able to obtain through the CARES Act. The test kits that the town has ordered is 4,660 test kits are available. There'll be 1 kit per person, and there's 2 tests per kit. A person, when they come in, they can pick up a test kit for each person in their household. Okay.
Anything for those who are homebound or?
Yes. Proceed. The distribution, I'll cover that in 1 minute, Mr. Chairman. The distribution will be free to Yarmouth residents. They must qualify by the low and moderate income households, which was basis of the town receiving the financial grant. They can be also, if they're seniors, disabled, or homebound, are eligible for the kits. Or if they're in urgent need, exposed at risk or symptomatic. We're working with the senior center now on trying to reach out to the homebound. We'll also be reaching out to Meals on Wheels and the shut-ins to get them out also. So we do have that in the works right now. Okay. The distribution at Town Hall will start this Wednesday. February 9th at Town Hall from 11 in the morning to 4 p.m. Wednesday, Thursday at Town Hall. We have the hours here. And then the following week, 14th through 17th, again at Town Hall while supplies last. Okay. The Senior Center will also be helping distribute the test kits starting this Wednesday, and they're going to go through the 17th also, and they'll do it while they're open 9 a.m. to 3 p.m. while supplies last. The test kits can also be available for people that need to just have evening. There will be evening hours by appointment. If you're not feeling well, we don't want you in Town Hall or Senior Center. You can call for an appointment for yourself or the family by contacting Mary Wagon, and we have this both her work number and her cell phone number, or she can be text. So there's several ways to obtain the test kits. This just reviewing the Board of Health mask advisory. The first one was issued in August 16th of 21 to be worn indoors of public buildings. That was issued in August. The board then moved to a mask mandate to be worn indoors of town buildings within meeting rooms. And that was issued by the board on November 15th. And then the board reinforced the mask advisory again to be worn indoors within all public buildings at the Board of Health meeting on December 7th. There's been several articles in the newspaper since November of the COVID issues on the Cape, and we can see starting in November through the Cape Cod Times has been covering it. It was just starting in November where 39 cases were reported at that time on the Cape, and we know how it's increased from there. We go down to the end of November 29th. There was then 200 new COVID cases on the Cape. We then go into December where the hospital starting to feel the strain of COVID cases within the hospital. We go down to December 30th when there was 1,800 new cases of COVID. So we went from 39 to 1,800 by the end of December. We go into January and we see cases, as they say, skyrocketing on the Cape, informing people to wear masks and get vaccinated. We then go down to January 15th and see the Cape has 44,540 COVID cases in 2 weeks, more than twice the week before. And that brings us right to the end of January. What we then did is the next thing on slide for questions is we added a question and answer section that people can look at for questions they may have. This site is the Mass Department of Public Health, and there's a hot link on the bottom that people can get even more additional information. But just to read a couple of the highlights, the type of information that would be available, because I know it's probably very hard to read at home. But the yellow, one of the top question is, will getting the vaccine negatively impact a person's immigration status? The answer was no, and it goes into detail. Second question we added was, should people who have had COVID-19 be vaccinated? The question is yes. You're not sure how long the antibodies are staying in you, so that's recommended. Is there a difference between Pfizer and Moderna when getting a vaccination compared to 2 doses? Next. Like to have a baby one day. Is it safe? Yes, per CDC. How long after getting the COVID vaccine does it take to be effective? It says usually a few weeks for the whole immunity to build up within the system. What should I experience symptoms? Will I experience symptoms after receiving a COVID vaccine? Yes, some people may receive a side effect. So that talks about that. If it continues, it mentions that you should contact your local healthcare provider. Okay. And I'm ending the slide presentation just with the last graphic so we know where we've been over the last several weeks. So that's the overall part of my presentation, board, and can ask, or you can ask some other pertinent information if you wish.
Do we have statistics on the percentage of the population who have received their booster shots?
Yes, we do. We do have it breakdown. I don't think we have that chart in there though. We do break it down by age group, and we're looking at if that's something. We did have it in our old layout, and we're looking at to put that by age group, who's getting the fully vaccinated or by boosted. We're looking at doing that, but it's probably another 4 or 8 slides that we would have to do, and we're just trying to see time-wise if we're able to fit that in. But that is something that we're looking at because, yes, board, that's a great question because we used to show that in the past.
Do you know, Bruce, of the whole population, what percent has received a third dose?
The fully vaccinated, we were at 77% that was fully vaccinated, and boosters was at 44%.
I have a couple things, Bruce. So one of the things I noticed that was missing in the slide presentation was, or I had 2 things. One, that you at Cape Cod Hospital, they are still doing testing, and you can actually, if you have a MyChart through Cape Cod Healthcare, you can make an appointment online. You don't have to call the number because the number, they're only there certain times. And if you want to make an appointment after 3 o'clock, you really can't. So if you can do that online through MyChart, and they give you a whole list of times, they're like every 10 minutes or something, and they're PCR tests, and you usually get the results back in about 6 hours. So I just wanted to throw that out there. I thought that was pretty good information. What was my other question? Hold on, I just drew a blank. Yeah, come back to me. It'll come back to me.
Okay.
Yeah, that's a good point at the hospital. I did talk to one of their person that runs the pharmacy, and they were saying that they had open appointments for vaccinations. You could just call and come right in. They had pretty much appointments within 1 or 2 days time. So for vaccinations, and they said they were very quickly on testing also. And I would say in general to the board, this data is on information that's provided to us. This does not include the home test kits. So anybody,
That was my other question.
Yeah, so it's anybody that tests positive on their home test kits does not go into this data. So this data is received from Cape Cod Hospital, testing vaccination sites, the community college, county health department, some of the other urgent care centers on the Cape. So
Are they just PCR tests that they're showing, Bruce?
yeah, I'm not aware of that, but I'm not aware of that, and that would not come back to us. It would be like
The only reason why I asked, because I know some of the urgent care, you can go in and I don't really know the difference between the tests other than the home test and then the PCR tests you can get at the different sites. But I know urgent care, you can go in and they give you a test and you can get the results in, I don't know, 15 minutes or so. I'm not sure if that's a different kind of PCR test, or I just was wondering. I don't know. No,
Not PCR.
it's
not
just an antigen test. Yeah.
Correct.
So
It's
so any of the stuff going through urgent care probably wouldn't show up in these records, is I guess what I'm asking. Right. And any home test. So even though that number is relatively small, the 60 something, that it could be double that for all we know,
Correct.
just based on.
Right.
There was an article in the paper, I think this past week or 2 weeks, talking about how poor overall in this country our COVID data is, because of all of these little things that we've identified in terms of reporting, lags in reporting, differences in reporting, differences in definitions, et cetera. And there's really been a call for a standardized national data system.
Often that's what happens after a disaster.
Right.
Anything else on that, Bruce, on statistics?
Nope, I think that covers the presentation. I know
People waiting, I know, so.
that kind of moves you down the agenda a little bit under discussion under the coronavirus. Chairman, if you wish to talk about the last 2 points.
Right, some discussion, if there is any, just on vaccination advisory and proof of vaccination advisory. It's something we had discussed, and just to see if there's any further discussion, and that might have something to do with people who've been very patient waiting to come forward. So perhaps people can do that. If there's anyone there who's held on this long, if they have any comments about the discussion that's about to take place, if there is any.
Yes, we do have somebody from the chamber, Mary Vilborn, the executive director of Chamber of Commerce, wishes to speak, but do you want to just discuss what the draft is first a little to the public?
Specifically what? The vaccination advisory?
The proof of vaccination advisory.
Well, essentially, I mean, there's a draft. Perhaps we can bring that up. I mean, if you have people watching this, I think it would be most helpful for people to be able to take a look at it, including the board members.
It will be available on our website also. I think it's probably, if we pull it up, it will be too small to read.
Okay, that's unfortunate. Okay, basically, this had to do with, there we go. The idea that people should, or, should we advise people to, besides getting vaccinated, but to have some proof of it and be willing to show proof of it. It could be on their cell phones, to just be able to show that it was advisory. It was not that store owners or restaurants owner were going to require it. I mean, there are towns that do that, but it was really more of advising people a little bit about where to go, based upon whether they're vaccinated or not. So just something to talk about. And it's been tough for us. Now we're in the 3rd year of this, and none of us are practicing clinicians or anything, and it's just trying to stay on top of it. If something changes, that we'd be ready to change something, whether to increase restrictions or reduce them or whatever. It's really the essence of discussion here tonight. If any board members want to, I know we just interrupted Mary, who's going to come forward. Mary, thanks for coming in.
Can you let Mary Vilborn in? Just 1 second, we'll let her into the meeting.
I can make a comment in the meantime. The Boston Globe on February 3rd had an article headlined, "The U.S. death rate is higher than in other rich nations." In recent months, the United States passed Britain and Belgium to have, among rich nations, the largest share of its population to have died from COVID over the entire pandemic. And since December 1st, when health officials announced the first Omicron case in the United States, the share of Americans who have been killed by the coronavirus is at least 63% higher than in any of these other large wealthy nations. So this whole idea of vaccination, people are dying because they're not vaccinated. And I think that probably all of us share the frustration that people aren't doing this and taking care of themselves and their loved ones and trying to keep them alive. This is the best we have to do this. So it seems to me that as a board, we should strongly urge people to become vaccinated. Without making it a mandate, because obviously that's not going to happen.
Right. Yeah, urge was the word that was in the advisory. That's all it
Right.
is.
Right.
As representative of the town, of really being not in charge, but I guess the board that's really looking out for the town. That's all. So make a decision whether to advise people or not to.
I mean, I feel like regardless of this document, we've made it pretty clear that that's the way to go is to get vaccinated and to get boosted.
Well, we've had a mask mandate, but we haven't really, and at mask advisory, but we haven't really come out with a vaccine advisory. I mean, yeah, I think it's pretty clear. I hope it's pretty clear to people that as a Board of Health, that's certainly where we're at. But we haven't said it, we haven't said it publicly, formally.
So basically the document would just be formalizing sort of our stance that we would like people to get vaccinated.
Not just like, but really.
Well, we strongly
Or-
urge them to,
right.
yeah, sure.
Yes,
And I
exactly.
definitely do, as someone who has been double vaccinated, boosted, and just got over COVID. So
Oh, gosh.
I'm pro-vaccine.
Whoa. Was it miserable?
It was pretty awful. I'm gonna be honest. I was a lot sicker, and you could probably still hear it a little bit
Yep.
than I had expected that I would be. And so I really feel for people who are choosing not to get vaccinated. And I'm assuming they're probably the ones in the hospital. And I feel and this is my personal opinion, I feel as though had I not gotten vaccinated and boosted, I probably would be one of those people in there.
I'm glad you were vaccinated.
Me
For
too.
sure. That's for sure. The other issue, which you shouldn't forget, is the issue of long COVID.
Oh God. I hope this is just short COVID because I'm already over it.
Yeah, it's scary. We don't know what's coming. Certainly, we're showing it's. Sure, you're worried about it, concerned about it.
Yeah.
Sure.
Anyway, I'm pro-vaccine.
Okay.
We do have Mary available to talk to the board right now, Mr. Chairman.
Yeah, sure. Mary, thanks for waiting.
Good evening. I really wasn't prepared to speak tonight. I was really just here to
Oh.
listen in, but as always, I continue and the chamber continues to appreciate all the work that you're doing. I think it's in some ways positive. Over the months that I've been listening to this board, you have always strived for the 80% vaccination and you're up to 77%. I mean, look at that. That is something positive for our community and we're reaching that goal and hopefully we'll exceed that far beyond what your expectations are. We are just very interested. I'm sorry, when I was joining as a panelist, I missed part of your discussion about the vaccination. I know it's not a mandate, advisory, I believe is the word that you would urge everyone to, and we would encourage that as well. So if there's any way we can help with the communication out to the business community, please let us know. And if there's any input from the chamber that you would like, Bruce certainly knows, and all of you know that you can always reach out to us.
Thank you, Mary. this was not a requirement of owners of, the stores and restaurants. It's not what this draft of, urging people to get vaccinated. It's not a mandate. I'm not sure where you came in a hurry, but that's all this is. It's sort of a formal way of, if it passed on the board here, just statement of what our feelings are, what we think is the correct thing to do. That's what it is.
And can I just ask, Mr. Chairman, where that document is available for review? I think I heard Bruce say it was on the website, the draft was, or is there a way that we could view that?
Bruce?
Yeah, it's a little difficult hearing the conversation here at Town Hall because the speakers are, I think, turned down. We've asked them to be turned up. So
Bruce?
I believe the question was, is this information from the presentation available? It will be up on our website. And the new slides, I did update it to you on Friday, but with the new test kit distribution slides that we added tonight, I can forward that to you tomorrow, if that's what you were asking.
She was specifically asking about the Vaccination Advisory, if that was available on site, online.
It was in
Or could
the,
that be sent to us, Bruce, for review?
yes, it
Because
was
it
in the
has-
packet that was mailed to you.
Okay, I'm sorry, I missed that if it was included in that.
I have,
If it's difficulty pulling off, I can send you that. I can send you that separately tomorrow.
Okay,
Mary, I want to be sure that, we're not saying that part of the advisory is urging people to show their proof of vaccination at indoor venues and for the owners of the venues to ask for it. We're not saying it has to happen. We're just saying we urge them to do that, and it's a way to reinforce the need for vaccination.
I completely understand where this
Okay.
board is coming from. I would just like, before it was sent out to the general public, if we could review and comment on it, if that would be acceptable.
Fine with me.
So I just had one other point I wanted to make, and again, pro-vaccine. The piece that I think is the part that, and I did listen to last week's meeting, and I thought Mary had some really great points about when the mask mandate piece was voted on, and how that it's really impossible for the onus to be on the businesses to be able to police the whole mask thing. I feel it's the same, and I understand we're urging them to ask for proof of vaccination. I just think that I'm for removing that piece out of the advisory, only because I was this was weeks ago, in Boston when they had required the proof of vaccination in restaurants and wherever, and nobody was asking, nobody checked it, nobody asked, nobody did anything. So I'm all for recommending the vaccination, urging the public to do that. I just think that piece in the advisory about requiring or advising or urging or whatever the verbiage is, businesses, I think it should be up to them to decide whether or not they want to do that. I don't think it needs to be in the advisory, just my opinion.
I had one comment on the advisory. I think it maybe might be an edit to make. It says, as of February 5th, 2022, only 77% of Yarmouth residents were vaccinated and only 43% were fully vaccinated. I believe that 43% is referring to the population that's had their booster. Does that sound right, Bruce?
Correct, boosted, correct.
Yeah. Yes.
Which I mean, that's how are people, by calling by using the terminology fully vaccinated, is that creating this false impression that that's the
All you need.
the end goal, like,
Mhm.
and I know that's probably not our definition. I'm not sure what other towns and really what it goes back to having some standard terminology for the data that we're collecting, but I mean, if 77% of people have 2 doses, why only 43% with that third shot, that booster? I mean, I think I hopefully we see the 77 creep up, but that 43% is not very good, obviously.
And it wasn't very effective against Omicron, those folks that did not have the booster. I think it goes back to, I mean, even when the boosters were first brought up, I remember Dr. Fossey saying that booster may be a misnomer because it really is a third shot, and that is what then is fully protective. But I think over time, I haven't seen that clarified or really defined further. I don't know if Bruce or Hillard have, or Deb, but I agree. It goes back to the definitions, and sometimes the common usage is different from what the experts at this time are saying, because that continually evolves. But yeah, but yes, that's correct. That should say 43% have been boosted.
Yeah, and I mean, I hesitant to even say this because it's obviously we want to get to 77% increased, but at some point I suspect that number could just pretty much plateau, and I wonder if it's wise to focus the effort on getting that booster percentage up. I don't know how that can be done, but I suspect at some point everyone's going to get the shot that's willing to get the shot. But I've talked to many people that got 2 doses, and for whatever reason, it seems like just like fatigue with the whole,
Right.
Everybody's fed up with the whole situation, and they just kind of throw in the towel and say, well, I'm not getting the boost.
Yeah, I've had that comment from family members, and it's a shame because, I mean, I think from the presentation, the town and the county has really gone far and beyond to try to make these vaccinations and boosters available to as many people as possible. But I think you're right. I mean, I think at some point we're plateauing because there are people who are just not going to get vaccinated. And I wish that we could identify them and maybe target some some outreach to them, because there's been more discussion in the literature about how it can be effective to listen to these folks and without judgment, address some of their objections. So, but that takes a lot of effort, a lot of resources, kind of a diminishing returns, I guess, for what we have to expend on trying to get people vaccinated.
Unfortunately, I think what it will take is infection or infection of a loved one, death of a loved one, things like that to in some cases change people's minds.
Right. And it's kind of a abstract when we say, well, it's also for the greater good of society, because the more people who are vaccinated, the less chance that the COVID-19 virus will continue to mutate and possibly evolve into something that's even more threatening or tragic in terms of the consequences. So, some people, like you said, for some people, it has to get down to a very personal level. And I think there's some people that just haven't been personally affected by COVID yet. And so it's just not that real to them.
That's a good point. The other variant we're seeing already is that BA2 is more transmissible than the Omicron is. You know, the mutated version that we have here now. So board members, what do you want to do about all this?
Do you want to, as a suggestion, board members, do you want to update the advisory for two comments that include that Deborah and Eric made? The advisory could be updated in some areas omitted and some areas refocused.
That's fine with me.
Yeah, I mean, it'd be nice to hear the chamber's comments, I suppose.
Yeah.
Right.
I agree.
I can make a draft, of a draft, Mr. Chairman, and forward it to you and the vice chairman to look at, and then we can decide to issue it from there.
Thanks for the effort, Bruce. That's great. We'll call it draft 2, I guess, whatever. But yeah, thank you. And we'll put it on for the next agenda. When is the next meeting? Anyone know this?
Yes, as we move into other business, yes, that would be, usual meeting within 2 weeks would have been February 21st, but since that's a holiday, we would just go to our next meeting, which would be the first Monday in March, which would be March 7th. Interesting, that's a month from tonight. That also gives the board time to work on the wastewater information so we can get that to the assistant town administrator. Then we also have one septic variance for a house that's going to be raised and replaced that we need to look at the septic system location on.
How can I get looped into the conversations, the email threads for the wastewater planning efforts?
I will forward your email to the assistant town administrator, Bill Scott.
Thank you very much, Bruce.
Bruce, you want to keep me in that loop as well? Thank you.
I will, yes.
I haven't been asked for an update from RAC, but you know, I'm happy to do that because I haven't missed a meeting yet. I have one other thing I wanted to mention. I got an important message from Medicare this last week talking about the vaccine, which I thought was interesting. So apparently this is part of the federal government's effort to get people to get vaccinated, and a booster, saying that particularly the booster, that it is free at no cost to Medicare recipients, and that it can control COVID-19 and protect against variants.
Thanks, Mary. Any other subjects we need to address? Any new, old business? Anyone? I don't.
Nope.
Okay, don't all jump at the opportunity, but someone could make a motion now to, let's say, adjourn.
I move we adjourn.
Okay, there we go. Is there a second?
Second.
Okay, Eric, if you said something, you would have gotten credit for it.
You can third it.
We'll accept a third. Any discussion? Good, there's none. Well, I'm in favor. I'll vote yay. Any, Mary?
Hey, yay.
Hey, yay. Okay.
Hey.
Deborah, and Eric's in. Deborah, you're in?
I'm in.
Oh, wow, we're all
Aye.
going. Aye, okay. This meeting is
We're out.
adjourned.
Thanks,
Thank you,
Bruce.
everyone. Have a good night.
Bruce, thanks a lot. Okay,
Thank
stay
you.
well.
Thank you, Director Murphy.
Yes, thank
Okay.
you. And
Better.
we'll
Keep
end
getting
in
better.
there. Hang in there, Deborah.
I will. Thanks.